And we want the best people. We want the best radiologists to read your films, and we want the best radiation doctors to give you the radiation, and the best physicists to do the planning, and that's what we try to do, get the best people to do their best work.
And how many doctors are there at your practice?
Oh, there's a variety of doctors. There's medical doctors, there's PhD physics doctors, and then all the doctors that we collaborate with.
Do you do any complementary medicine or integrative?
Well, we talk about that, and we've actually had a special show about complementary medicine, and that's a whole new topic which we can talk about in a nutshell. But, there's not really complementary medicine. Either there's medicine that works or there's medicine that doesn't work. And if medicine works, then it's not really so-called complementary medicine. If you're talking about vitamins and herbs and stuff like that, well, there's studies that we've addressed, and actually most of the studies show that people with cancer who are taking megavitamins or antioxidants increase their death rate by about 20%. So we're one of the first groups that are out there saying, look, if you take things that aren't going to help you, they may well hurt you, and you should be aware of that. Most hospitals are setting up complementary medicine departments, even though there's not data showing that it works. So let's go for the data.
For example, AHCC, which some doctors recommend.
Well, look at the data.
Mushrooms.
Look at the data. We'll look at the data when you come in. We'll sit down and I'll show you the data.
Okay, doctor. Thank you.
Thank you. Have a good day. God bless you.
Bye.
Bye now.
Thank you.
Bye. This is Dr. Lederman, the Radiosurgery Hour. I'm here with Rob Spencer. We missed a call, so if you were the person who called, I'm sorry. The phone systems at WOR are kaput today. They're supposed to be back and running soon, but if you were the caller, please call back and we'll try to answer your questions. So our patient with the pancreas cancer we're going to talk about. So he had surgery in the pancreas. This was 4 years ago.
Mm-hmm.
Okay, he went for surgery. And then he saw the medical oncologist. And the medical oncologist started giving chemo. And he actually ended up having about 3 years of chemo.
Okay.
Well, I don't know if anyone ever looked at the pathology report. Finally, a couple months ago, the family brought me the pathology report. The pathology report from 2009 showed the margins were positive.
Okay.
So what does it mean when the margins are positive?
They didn't remove the whole thing.
They didn't remove the whole thing.
Right.
So when they didn't remove the whole thing, when the margins are positive, it means that
there's more cancer.
Cancer cells are left behind.
Right.
So one of my famous bosses, C.C. Wong, was a very famous cancer doctor in Boston, and he used to tell people C.C. stood for cure cancer. If it's positive margins, it means it was just a big biopsy.
Yeah.
That's all. It was a big, painful biopsy. The cancer's left behind. And so what do you do usually when the cancer's left behind? Well, either you can do another surgery if you can find the cancer, or you do radiation to try to sterilize the cancer cells.
Yeah.
And he never had either.
Mm.
So he went through 3 years of chemo, and they had a lot of chemo and a lot of toxicity. And then the family came to me and brought me the pathology report and said, what do you think? I said, well, I think that he needed radiation. He really needed radiosurgery. Radiosurgery allows us to focus on the right area.
Right.
He needed radiosurgery back in 2009, and you've left cancer cells there untreated, basically, or inadequately treated.
Yeah.
And the family said, well, my doctor never told me that. My doctor said to take chemo. And I said, well, sometimes chemo doctors don't know everything about radiation or surgery. I'm a chemo doctor.
Mm-hmm.
I spent 6 years at Harvard giving chemo, studying chemo, and I know what chemo doctors know, and I also know what they don't know. One reason I trained in 3 areas, internal medicine, medical oncology, and radiation, I'm board certified in 3 areas, was to try to allow the patient to have more information about what to do.
Yeah.
By training in 3 areas, it meant to me that I could be a better doctor to myself and to my patients.
Definitely.
And it took a lot of time. Most people are not training for 9 years after medical school.
That's right.
So he said, well, why didn't my doctor tell me? I said, well, I don't know. Maybe your doctor doesn't know everything. Maybe not every doctor knows everything. I don't know everything about everything. I mean, you don't know everything about everything, but you're probably closer to it than me.
Nope.
But, you have to get the best doctor who knows their thing. And for this patient, they were left with positive margins for 3.5 years.
Mm.
And so we gave radiosurgery last spring. He had a PET scan. The PET scan showed activity in the pancreas consistent with recurrent disease. So the cancer probably never went away, despite all the years of chemo. He got radiosurgery, which is focused beam treatment, non-invasive, no cutting, no bleeding, no hospital stay. We treated the tumor, and then he came back this week with a new PET scan.
Mm-hmm.
And guess what?
It's gone.
It's gone.
Excellent.
It's gone. So for the first time, to the best of my knowledge, the cancer in his pancreas is sterilized.
Yeah.
So just like this man who called a few minutes ago, whose friend is 58 with back pain, pancreas cancer. He's probably got back pain due to the cancer, and we can probably take care of it. Probably 5 treatments, radiosurgery, non-invasive. We can probably take care of it. I can't promise anybody anything. We never promise anything to anybody. We promise to do our best.
Yeah.
And hopefully he'll send his friend over, or at least give a call so we can talk about all the options that are available.
Definitely.
Anyway, we missed a caller. I'm sorry. We just have my cell phone working today, so you can call 212-CHOICES, 212-CHOICES if you have a question. If we didn't answer your questions, you can call in to get information and a DVD mailed to you. We're happy to do that, so feel free to do that. We had other cases this week. We had more Jehovah's Witness people. Jehovah's Witness people are people that do not want blood transfusions. And if you think about all the people that got hepatitis and AIDS in the early years, maybe they were right to some degree.
Mm-hmm.
I mean, I'm not saying anybody's right 100% of the time, but there probably are reasons in the past not to get blood transfusions from hepatitis and AIDS and other diseases. Have you heard about people who got sick from blood transfusions?
Yeah, I have. I know someone who got hepatitis C from it.
What? How many years ago?
It was probably in the 70s or so.
Yeah, before it was screened. Nowadays it's screened. Good morning. You're on radio. This is Dr. Lederman, Radiosurgery New York.